Consider a situation where you are having a meeting with your colleagues and your boss, and he casually mentioned that all the employees in the company should be punctual. Many of the colleagues were there. You all heard what your boss said. You go back home and you keep on thinking that when he talked about punctuality, was he referring to me? Because last week I was late once because of the traffic. Maybe your boss was not referring to anybody in particular. Maybe he was talking about a general company policy. But you tend to think that it was related to me only. I am the one to blame for such comment. This is an example of personalization that we see in many people that may be associated with some mental health problems or not. Another example, your daughter did not perform well in this semester. There can be many reasons for it, but you tend to connect it with your contribution to your daughter's study. I could not guide her properly. Maybe I did not give adequate time. So you tend to blame yourself again. These are called the cognitive distortions. Cognition means the way we look into things. So a negative mood state causes cognitive distortion, means it will change the way you see or perceive the situation around you, the world around you, and also the persons around you. And if not corrected in a proper time, it will eventually land you in a loop of negative thoughts that will worsen the depression or anxiety or any personality disorder that you are suffering from. So when we think about mental health or psychiatry, we think about something very abrupt and serious that will jeopardize everybody's life. But it is not the case always. Sometimes we suffer from some small problems in our day-to-day life and also in our thought patterns that hamper us. So psychiatry is not always about medication, about treatment. Sometimes it is about getting the clarity about your thoughts also. That will help you to work in a better fashion in your day-to-day life and will help you to be a better self. Thank you for listening.